Hey, Mike Matthews, physical therapist here with the PT411. Our last few videos, we've been looking at positioning of our lumbar spine or posture of our lower back. We've been looking at it with sitting. We've been looking at it from sitting to rising, rising to sitting, with bending, with squatting, with everything in between, including athletic movements, loading up to jump. Just really making sure our spine stays in a nice neutral position so that our weight gets equally distributed through each and every vertebrae and each and every disc throughout the entirety of that disc and in the entirety of that vertebrae without any pressure getting put too much in one spot versus the other. And if you haven't seen those videos yet, links to those should be flashing around on the screen at the moment. So we've talked about correcting our posture throughout the day, breaking bad habits. So depending on how old we are depends on how long our spine's been loaded in one position versus the other. So we've talked about our spine in this nice neutral arch position. This is the front, this is the back. We're just looking at our lumbar spine right here, that low back. As long as we're in that nice neutral arch, everything is nice and neutral. Weight is evenly distributed through each and every one of those discs. There's not too much weight in the front, too much weight in the back. But when we start to flatten that back out, not even bending forward, just flattening it out, now the front of our spine is starting to compress more and more. The back of our spine opens up, our discs start to move backwards. So not only are we having that extra pressure in the front, our discs are getting pushed backwards, and as we start to bend more and more forward, everything starts to force even more back. Over time, the back of the discs start to overstretch, and whenever we come back to neutral, now these discs are pushed way back this way instead of being nice and neutral, and now we have a lot of obstructions in that back. So you're sitting in the classroom all day, you're sitting in the office all day. Every time you go to bend down, every time you go to sit down, you bend at your back instead of bending at your hips. So now over days, weeks, months, or years, we're in this forward flex position, and over time, to avoid these obstructions, to avoid banging into these discs that are migrating further and further back, now we start to actually actively flatten that back out. And even more time goes by, we start to have to actively round out that back to accommodate and avoid those obstructions, avoid banging into those discs. Now our comfortable go-to position is way up here, and we're getting more and more prone as time goes on to injure this back even worse. Then when we do injure that back from being in this position, what is the first thing we do? What is the first go-to position? We accommodate for these obstructions even more. We start to bend forward. We reach for our toes. We think we need to stretch out our hamstrings. All we know is it feels good to start stretching out this way. But all we're doing is we're taking pressure off of that obstruction and actually pushing it further and further out over time. What's the other thing we end up doing? We end up getting on our backs. We start bending one knee or both knees up to our chest, and same thing, all we're doing is accommodating for that obstruction back there, and over time we're just making it worse. So what do we need to do to start fighting these obstructions? We need to start arching the back. Not only do we need to start arching the back, we need to start actually overarching the back. And it's not comfortable. It's something that most people want to avoid, because now we're banging into these obstructions. We can be causing localized pain. And if that disc is impinging on a nerve, as we start banging into that obstruction there, now we're going to start lighting up our leg pains. A lot of people feel that, and they immediately give up on it, and they start going back to flexing that back and accommodating that deformity and making it worse over time. But as long as it's a relatively short-lived pain that we're provoking, it's not a bad sign. And usually what ends up happening over time, as we start to push that disc back into place or whatever is obstructing our movement, our pain starts to get more localized, starts to centralize, get more center along that spine. So there's 3 easy positions that we can get into to start stretching that back out. So the first position, standing up, all you have to do is put your hands behind your back. You can have your entire palms back there, or you can just place your thumbs in the small of your back. And you're just going to lean backwards. Starting off, just kind of getting a good feel about where it gets uncomfortable. We're not doing a sustained hold either. Most things in that lower back that we're trying to mobilize here respond a lot better to repeated movements than a sustained stretch or a sustained hold. So we're only going back and holding for a second or two before we come back up to the middle here. So over time, what should happen is as we keep repeating this, we should be able to start going a little bit further and further before we find that discomfort as we start mobilizing that back. Or as I said a second ago, the pain might be traveling more closer to the middle of the spine or even up the spine a little bit. And even if that's hurting worse, that's always a good sign if we can get that pain to centralize, to localize to the problem spot. So we work on this nice and gently, just slowly flirting with that discomfort, but not really pushing too much past it. And we're working about 10 to 15 repetitions each time we do this. And we're doing this every 2 or 3 hours throughout the day when we have a problem. When we don't have a problem, we're still getting up every once in a while from our seated positions or from our bending positions to start stretching it out, going backwards. And if we're stuck at our desk, we don't even have a chance to get up throughout the day. The next best thing while we're sitting down is rotating those hips. We want to rotate those hips forward as far as we can. As we rotate them forward this way, we're arching that lower back there. Same thing, we're just flirting with that pain. We're trying to go a little bit further and further, holding about 2 to 3 seconds, doing this about 10 to 15 times at a time, every 2 hours when our back is already hurting us. A little less often, but still throughout the day when we're just trying to maintain a nice and healthy back. But these two positions have a couple of big limitations for the goals that we're trying to make, trying to get everything mobilized here. Like I was saying earlier, we have to wind this back up a lot. We have to get this back close to end range to get a good enough mobilization to reverse all the negativity that we put on our backs over the years in these horrible postures. And our other limitation, if we go back to the drawing board here, everything we've talked about has been in an upright position. Every time we're sitting, we're standing, we're going to bend forward, we're going to squat down. We have gravity always pressing straight down. And that's going to overall compress everything. We're taking the weight of our head, our shoulders, our thoracic cage. Sometimes we got to take this gravity out of the equation. Most of the time we don't need a fancy traction table or inversion table to get the job done. Don't get me wrong, those can be definitely good supplements to this, and sometimes they are indicated and definitely needed, but most of the time they are not. So we have these two fairly big limitations with these first two stretches that we went over. One, we're not getting this back, we're not getting this spine all the way to end range. And two, we have gravity against us. We have gravity pushing straight down on our spine, limiting our mobility as well while we're doing this. And it doesn't take much to address these two limitations. All you need to do is lay down on the ground, laying down flat on your stomach here. You're gonna have your hands down in a push-up position down on the ground here, but instead of pushing your entire body up, you're just going to be pushing your upper body up. You want to try to push up. The goal is to get our arms fully extended, get those elbows into a locked position if we can. But same thing as the other exercises. You want to start to go slow, find that discomfort level and just kind of flirt with it. Over time, you want to try to start pushing through it a little bit more and more. See if we can get past those obstructions, start to get those mobilized, take it further and further until over time, which could be over a course of a few repetitions or it could take several days to weeks. We get to the point where our arms are nice and locked out. We're able to achieve this nice, good arched position. Or let's say that you've been sitting all day, or you've been crouching down, you've been bending forward all day. Now your back is nice and stiff. It's very difficult to do this exercise, very difficult to move around. You're stuck in this hunched forward position. You can't get upright. First thing you got to do is just try to lay flat on your stomach. And all you're going to do is just hang out there 3 to 5 minutes, not even moving. Or if that's too uncomfortable, get a couple of pillows, put it under your stomach, have your back started in more of a rounded out position, and actually accommodate that obstruction for the next few minutes. Hang out there. As that gets to be more comfortable, your back starts to relax, remove that pillow. If you're already at that point where laying flat is nice and comfortable and everything's nice and relaxed, now we're gonna get our elbows more underneath our shoulders there and get that back into a little bit more of an arched position there. Then when that position gets more comfortable, we can lay flat again and start working into those press-ups. If we have really flexible backs, if we're not quite getting rid of all the pain with this, we can always take this mobilization even further. You're getting into the same position here. We're gonna press up again, but this time we're actually holding it here longer. While we're holding it here, we're gonna take a deep breath in, and as we breathe out, we're gonna relax our hips and our back. Everything will sink down a little bit further. So I'll do that without talking, just kind of watch my back right here. And as I breathe out and exhale, everything goes that little bit further. Once you start taking it to this point, you might start feeling more of a pinching sensation around your lumbar spine, a little bit of a strain. That definitely means we're taking it all the way to that end range. Some people, it's not necessary to take it this far. Athletes, people that are very flexible, or people that are getting good relief with the last few steps but don't have that complete relief, are definitely going to need to take it this little bit further to get that correct mobilization. One big thing to watch out for when you're working on this one is if you come straight out of this exercise trying to go to stand back up, your back more than likely, definitely if you're not used to this, is going to be stiff. It's going to be very difficult to move. A lot of people end up getting discouraged from doing this exercise anymore. But that's not necessarily a bad thing. Imagine if you were to take one of your fingers here and you were going to push it backwards. Either you're holding it there or repeatedly just pushing it back this way. Over time, whenever I go to try to bend the other way, if I try to move that finger in any other direction, it's going to be really stiff for a few minutes. And this effect happens in a nice healthy joint. When the joint is injured, this gets amplified big time. So if you experience this, the best thing to do is to lay flat on your stomach after you do those press ups. Just lay there for a couple of minutes before you get back up. But there's definitely a few things to watch out for when deciding if these exercises are going to help out with you. Now, if consistently every single thing always hurts you no matter what you do, sitting, standing, laying down in any position, walking, bending forward, bending backwards, twisting, if everything bothers you, it might be a little more complicated than just trying to arch backwards no matter what position we're in. It's definitely a more complicated discussion and takes way longer than a 7 to 15 minute video to cover. But most back injuries, and I'm not saying all, but most back injuries, I guarantee you can be traced back to what we're talking about right here and in the last few videos. And one of the biggest limiting factors to success for treating the low back comes down to the MRI. People that get MRIs way too early after they injure their back, or when people don't take their MRI results with a grain of salt. If you want to learn more about that, check out the video that's popping up above my head right now. But really, that's it. There's not a lot to it. We end up putting our back in a very compromising position throughout the day, and we just really simply need to reverse it. Again, I'm Mike Matthews with the PT411. Thanks for joining. Hey, thanks for tuning in to the PT411. I hope you enjoyed this video. Definitely hit the like button. If you're not already on YouTube, head on over there right now. Make sure you hit the like button there. Make sure you hit subscribe so you can be notified when I come out with my next video. If there's something that you would like for me to address in a future video, hit me up in the comments section below. Other than that, again, thanks for joining.